Until the 20th of October, the war wounded continued to arrive in the surgery ward of the Casa Ahmed hospital in Misrata. Most were from Sirte, about a 2-hour drive away, one of the last bastions of the former regime and the scene of fierce fighting. The wounded were stabilized near the front line before being transferred to the hospital. More than 450 patients have been operated on since May. The wounded include prisoners captured by the new authorities and who are treated by MSF.
There are many serious injuries due to the types of weapons being used, mainly heavy artillery, firearms and explosives, often causing extremely complex fractures or deep wounds, hence the use of external fixators and even the need for amputations.
I just want him to stand before he takes them.
Physiotherapy care is provided in this school converted into a military prison. It houses about 300 prisoners of war. The MSF teams offer regular medical consultations, nursing care, but also psychological support. In camps like this one in the Hoden district, nearly 5,000 children in Mogadishu have received therapeutic food in recent weeks. MSF wants to go further in treating the most severe cases of malnutrition. Nearly 500 children were hospitalized in September. 40,000 have received measles vaccinations.
The fact of having vaccinated 40,000 children is good for them, but it's not enough. At least 10 times more need to be vaccinated to ensure broader coverage and to have a larger impact on the epidemic.
The problem is access to the refugee camps, both in Mogadishu but also outside, where the camps are among the most densely populated and under the control of Al-Shabaab.
For several months we've been trying to negotiate, not just to gain access because we already have that, we've been running activities for years, but to expand our activities to provide a medical response in today's crisis.
Ensuring broader access to medical consultations and, when necessary, hospitalization demands and depends on lengthy negotiations. Severe dehydration can prove fatal. Cholera continues to be a scourge for the people of Haiti.
I've been here a week. I was given injections and made to drink oral rehydration solution constantly. When I got here, I was almost dead. I was blind and couldn't stand up.
In the suburbs of Port-au-Prince, the MSF cholera treatment centres have been faced with an upsurge in the number of cases since September. The populations in rural and slum areas are the most affected as they lack access to drinking water and sanitary facilities.
When they arrive, some are in a critical condition, some even die on their way here.
As the rainy season approaches, further outbreaks of cholera are feared as the epidemic can spread through watercourses. But over and above the emergency medical response, hygiene awareness and prevention campaigns, the training of medical personnel is today a priority. The aim is to ensure that the public health structures will be able to deal with the cholera epidemic on their own. MSF arrived in Kano in 2009 in response to a nutritional crisis. Since then, it has been preoccupied by the prevalence of HIV/AIDS and tuberculosis, two significant factors in premature mortality. An assessment has revealed alarming mortality rates in this diamond-producing region.
Access to healthcare is difficult owing to the distances involved. There is no access to care between the central hospital in Kano and the other peripheral centres. Some villages don't even have a basic health post.
Dealing with HIV/AIDS starts with awareness and encouraging people to go for screening. Between the Kano Hospital and the 3 peripheral health centres supported by MSF, nearly 600 patients are today receiving antiretroviral treatment. The pharmacy has been supplied with drugs and the laboratory refurbished. Another priority is to train the heads of the health centres in the opportunistic infections linked to HIV/AIDS.
The complications we frequently encounter in the clinic are pneumonia and tuberculosis. We also see patients with weight loss due to chronic diarrhea who need to be hospitalized for stabilization.